Hi, my name is Daniel Prang, and today we are going to discuss the topic of developing and coaching staff. The process of developing and coaching staff is the training of new nurses and obtaining the best from your staff through support and teaching. So the first thing we need to address is, what is coaching? Coaching is a strategy that helps recipients focus on solving specific problems or conflicts. These conflicts can be varied. They can be across the board in your workplace. They may be a performance issue, an area of your work that you're struggling, something you have a hard time doing. It can be a personal conflict. In healthcare, especially, lots of nurses on the floor. It can be between you and another nurse, you and a doctor, um, those kinds of personal relationships, not necessarily a performance problem. And the other part of coaching is that it needs to be ongoing and that it's essential to optimal performance. Coaching doesn't end when you get off orientation or once you've been a nurse for 2 or 3 years. I mean, coaching is a lifelong, career long thing that needs to happen to make you the best you can be. So, next is, who can be a coach? A coach can really be pretty much anyone that you can learn from. There are professional coaches. Sometimes, if there's a certain scenario or a new initiative that has been implemented somewhere else, they may bring in a professional coach, somebody who's worked with this before, to guide you, to support you, to show you these things. Coach can be someone that's from human resources. That they can send in again to guide you and show you what you need to do. They're more of an outsider. More personal level coaches can be in healthcare, again, your nurse manager. And it also can be your peers. When you're a new nurse, some of the best resources, some of the best coaching you can receive is from a nurse who has been there longer than you, has practiced longer than you, has seen things that you haven't seen. They can be a great resource and can be really encouraging, especially for the new nurse. So, what are the benefits of coaching? Coaching supports professional and personal development. It helps you as a whole in your job be the best that you can be. It is something that focuses on the future and the creation of your highest potential self. Again, the goal of all coaching is to make you the best employee and the best you can be in your current role. It focuses on identifying opportunities for strength based developments. Coaching can be very specific. You may have one small area of your work role that is where you struggle, and you do phenomenal in your other roles. That doesn't mean that you're above coaching, and coaching can really help you round out your performance and help you make the most of what you're doing. Coaching relies on the creativity and the resourcefulness of individuals to generate their own intention and solutions, with the coach supplying non-judgmental, inquiry-based approaches and principles. What this means is coaching is not just someone who tells you what to do. Coaching is the process of somebody tapping into the knowledge and the skills that you already have and helping you optimize them. It is Coaching overall is meant to be a positive, uplifting experience. They want to take what you know and take what you have, and they want to make it the best you can be. Like a coach, even in a sports role or a personal life coach, what they're doing is taking skills that you have and helping you fine tune them and make them the best. Coaching also draws on the philosophy of positive psychology and cognitive behavioral sciences to increase self-awareness, choice, and self-trust. This goes back to what I just said. It's a positive experience with the coach. Yes, they are bringing out a shortcoming per se in your performance, but they're there to help you overcome that in a positive fashion. And the way that they want you to overcome that um, is so that when the coach is not around, you're aware of this. Um, that's the self-awareness piece. You make the right choice and you trust yourself to make the right choice and to follow through with what you have learned and do the best that you can in that scenario. So, how do we coach? Coaching is a part of many different aspects in healthcare. Um, the coaching process in nursing begins officially at the day one of your hiring. Um, on the job, but the coaching process is really even what your nursing instructors are trying to do. That's a little bit more of a teaching role because you haven't, gained that education yet to where you can coach it and fine tune it. But coaching is something that happens throughout your whole education process and your whole career process. So one of the very first things that happens when you're hired as a new nurse in coaching is the new hire orientation. Um, Different floors, different hospitals, they all have their own policies. Where I work in the emergency room, it's a 13-week orientation, and they pair you up with a preceptor. And that preceptor is really, in a lot of ways, your coach. You've learned how to be a nurse in nursing school, you've gained a lot of knowledge in nursing school. That preceptor is just there to coach you and help you apply that knowledge that you already have. They're not there to teach you the things. That you already should have learned in school. They're there to coach you and help you apply it. Mentorship goes along with the orientation. Mentorship and coaching are a little bit different, but there's still a role of coaching in mentorship. And it's a good example of that is that orientation, that preceptor, that mentor, and a small role as a mentor is that coaching. Another place that coaching takes place is the nurse residency programs. They're becoming more and more popular with new nurses. Again, it's an opportunity to help round out your knowledge, help you apply your knowledge, and be the best nurse that you can really be. Another place of coaching that is seen a lot is through authentic leadership. Most of the time when you think of leadership, you think of an executive or your nurse manager, but really anybody can be a leader. A senior nurse on the floor can be a leader. One of your peers may be a natural leader. The definition of an authentic leader is someone that has honest relationship with their followers. They value their input, and it's built on an ethical foundation. So then the authentic leader is someone who, when they're coaching, they appreciate the knowledge that you have. They come at you fairly. They are there to, again, really coach you to be the best that you can be from a leadership type of role. One of the largest benefits of coaching is preventing burnout. Burnout is something that happens to lots of nurses, unfortunately. It's one of the biggest reasons that people leave the nursing career. It's one of the biggest reasons that people don't stay on certain units or certain floors for very long. A rough definition of burnout is a struggle to maintain confidence in meeting job demands due to a sustained response to chronic emotional and interpersonal stressors at work, resulting in poor mental health. Basically, the short version of that is that you are just overwhelmed. You have too much on your plate. You feel that you can't function in this role. You feel like your relationships are falling apart, maybe both inside and outside of work. And you get overwhelmed, you get burned out, you just can't do it anymore. Coaching can be a big part of getting you through something like that, especially for the newer nurse or the nurse that may be dealing with these things for the first time in their entire life. In one of the articles that I reviewed, has a rather lengthy title, I'm sorry, is The Effects of Authentic Leadership, 6 Areas of Work Life and Occupational Coping, Self-Efficacy on New Graduate Nurses, Burnout, and Mental Health, a cross-sectional study. That's a mouthful of a title, but one of the big things that I gathered from this is the different areas in your work life that help you be a complete employee, that help you to be happy where you are, help you to be less likely to be burnout and overwhelmed. Those 6 areas are pretty self-explanatory. We won't get into them too deeply today, but they're your workload. Can you handle what's expected of you? A feeling of control. Do you feel like you're playing catch up all day while you're working, or do you feel like you're in control of what's happening to you? That's an area that coaching can be a big part of. It can teach you to take charge of your assignment, take charge of what's happening, and show you how to do those things. Rewards is an area, that comes from, do you feel valued? Do you feel rewarded when you do something well? The community, that's just the people around you, your peer group. You need to feel happy and safe and accepted in your community. Fairness, Fairness is another area that's slightly related to coaching, and this is in the fact that you don't feel coaching is supposed to be a positive experience. You shouldn't feel that you are singled out, um, and that you are the focus of, it should be something that is private, something, that you're being coached behind the scenes. You shouldn't feel like you're being made an example of. Everyone struggles from time to time. Everybody has, an issue somewhere. None of us are perfect. Coaching helps us address those issues, but we really need to feel like they're being addressed fairly and we're not being put on display. And then the last of the 6 areas of your work life is value congruence, and that's just, you feel valued, you feel on that equal playing field as your peers and your fellow employees. So coaching is a big factor in reducing burnout, is the point of all that discussion on burnout. Coaching helps you be that whole employee. It helps you feel like you are a part of that team and that you are, doing what you came there to do. A couple bullet points on that. Coaching reduces turnover. If you're happy in your job, you're more likely to stay there. You're more likely to become a better employee, and you're more likely to be, a part of that team. Secondary to that is cost savings. Um, the burnout and the people leaving and is one area that coaching saves costs because staff retention is a cost saving measure. But I mean, if you're coached and you're performing at an optimum level, that as well is a cost saving measure. You're not making mistakes. You're not having to do extra tasks or spend extra time on things. And those things in a roundabout way are cost saving measures as well. If you're coached and you all those things we talked about, you're coached to a point where you feel like you're engaged and you're taking part, and you're a member of that team and you're doing what you're there to do. It creates a happier and a healthier staff, and that benefits everyone. That not only makes the workplace better, but it also, improves patient care. If you're fighting with your coworkers, you're less likely to be paying attention to your patients. And, that attitude is contagious. If they look around and patients, when they're in your unit, see happy staff and, a more upbeat attitude, that's contagious. They're more likely to, one, feel like they're being cared for well, and two, that overall satisfaction. And those are types of things that coaching can help you get to in your work life. This slide's just a couple funny different cartoons about nursing. The one on the left, she got 2 compliments today and she couldn't handle it. That's something coaching. Part of the coaching that we talked about is that positivity. You need that reassurance, especially when you're newer and you don't have that confidence anymore. The other two are just kind of little funny memes. One, he blew up because he couldn't take it, which obviously can't happen, but you don't want to feel like you're that burned out. And the other is a guy who feels like he couldn't keep up, so he had to live off coffee to make it through his day. I drink a lot of coffee, so maybe I need coaching. I'm not sure. This is just a video. This is not a healthcare scenario, but this is in a scenario where someone was effectively coached, and it shows how, it starts off, it shows a couple areas that, she gets called out in front of a fellow employee, and how that is a problem. But then it also shows, how through coaching and how through allowing the employee to see her own mistakes and learn from them and build on them, that is a good example of that in that scenario. So very last is a review. Just brief bullet points. I don't want to beat on these. We've talked about it too much. But coaching is something that really any staff member could benefit. Nursing is a tough job. Healthcare as a whole is a tough job. We see a lot. We deal with a lot. And the support and positivity of a good coach can make all the difference. It can also, the point of coaching is to make us the best that we can be and fine tune our skills. So it improves performance through that positivity. It leads to a happier, healthier staff, which improves the unit across the board. It's a better place to work. It's a better place to be a patient, all around. And then the secondary portion of that is, the cost savings, secondary to the increased performance and the increased attitude of your staff. And, people are going to want to come work there. If, everybody's happier on that floor, you're going to get good nurses. You're going to get happier nurses. You're going to get great care there. Coaching is a great way just to get the most out of your staff. Lastly is the reference page. Thank you.